or man-made. And so in November of 2005, this DoD directive said that stability operations, okay, this kind of humanitarian support shall be given priority comparable to combat operations, okay? So we don't just blow up things and kill people. We have to provide medical stability operations. And so in May of last year, the medical slice of medical stability operations, if you will, established policy, assigned responsibilities, and provides instructions for medical use. So the problem is we go into places like Iraq and Afghanistan where I don't have State Department who's got the responsibility to go out to an area and provide medical stability operations. So who do they put out there? They got some reservist from Iowa who was a fireman who says, guess what? You're now in charge of medical stability operations for this province in Afghanistan because it's too dangerous for state to go there. We understand that. Problem is, how do I get that fireman trained up to do medical stability operations? So hip pocket training again. I take out the cell phone. I got Leader loaded on there. I download on there, working with a Joint Forces Command, this ability to do distance learning. Our commercial partner here is Tribal Medical out of the United Kingdom. We've had several meetings. We have a big kickoff meeting next second week in place. And so how can we do that? TATRC, the organization I'm part of, is the technical lead. We have 14 nations involved. This is coming out of the Office of the Secretary of Defense. So it's a big deal. We're looking at this mobile learning environment. It's not just putting PowerPoint on a BlackBerry. It's got to be more intuitive and user-friendly. And so we're trying to use this medical stability operations as the first application out the door and try to grow other things over time. That's the fourth project. The last one is Text for Baby. And if you're not familiar with this one, please be mindful because I think this has important opportunities. It's the first ever free-to-end user mobile health information service taken to scale in the U.S. It's a consortium of Oxiva, the Healthy Mothers, Healthy Baby Coalition. There's HHS, Johnson & Johnson kicked in some money. It's an educational program of the National Mothers Healthy Baby Coalition. It allows women to receive timely information on their cell phones. Again, we don't give mom a cell phone. If you got a cell phone and you have a text plan, then you can participate. You're going to get 3 SMS text messages per week. And again, we've got now I think it's close to over 100,000 women, and well over 2 million messages have already been released. This kicked off in February of last year. The White House Science and Technology Office, Mrs. Obama is very aware of this project, so it's got high visibility. We've got the content coming from the Healthy Mothers, Healthy Baby Coalition, HHS, CDC, a lot of other folks, J&J, are all providing content that covers a wide range of clinical information, whether it's smoking cessation or prenatal care or nutrition. Questions like, you're not alone. If you need help, call this number. A seatbelt protects you and your baby. So when you enroll, they ask you, what's your due date? And it gives you educational content unique to that trimester of pregnancy. So and it follows you when baby's born. You let them know, baby's born. Okay, guess what? You gotta go to the doctor 2 or 3 days after you get discharged from the hospital for a follow-up appointment. Or you need to keep baby's mouth clean by just getting a washcloth and wiping it out. That kind of information is really critical for some new moms or young moms who don't know this information. So the way you do enroll into the program, you register by texting baby, or en español, bebé, and you use the short code 511411, right? You get a registration survey. It asks you like what's your due date. You get a starter package of key messages. You get free tips. You get an evaluation, and then there's a 2-year trial. This is all free. There's no charge to participate. That's really important. There's no charge. The website, textforbaby.org, if you need more information on that. So what are we doing? So we're evaluating this. So TATRC has signed a cooperative research and development agreement with all these different partners. We're relying on George Washington University to come in as an evaluator for this, for conducting research on how well this is going to work. We've got a medical center identified. We've got a protocol written. Again, that's hard work for those of you that deal with institutional review boards, etc. The Our goal is to use this pilot project to develop and test and evaluate an evaluative framework. I'm using this project as the framework to evaluate a lot of other mobile health things that we want to do. Okay? So I think that's going to be really important. So GW is involved. It's going to randomize 1,000 women. They're going to be active duty and dependents. We're going to compare text for baby and usual care, compared to just usual care, just like that diabetic population. It's powered to detect whether or not there's an improvement in what's called the prenatal care utilization, the PNCU. The hypothesis of the study that we're doing at the military base is text for baby will promote prenatal care utilization and prenatal healthy behaviors targeted by text messages looking at these key areas: smoking, alcohol use, immunizations, etc. So the evaluative framework is really important because, again, mobile health, there just isn't a lot of good prospective randomized studies on the use of cell phones in healthcare. But so the key is you get people enrolled in the study, and we're looking at the process evaluation. How well does the process of getting people to use this information works? What are their reactions? What are their receptivity to using this kind of technology? And then we're going to look at outcomes of being involved in the study. For example, self-efficacy to navigate the healthcare system. So, Mom, you didn't know how to get appointments. Now that you get these text messages that tell you, do you feel like you can navigate the healthcare? That's an important outcome measure. And then behavior change. Remember, go back to that study I was telling you about. We believe text messaging, cell phones will change behavior, but we have to prove it. So now they're seeking more prenatal care. They quit smoking. They're taking care of baby, that kind of thing. And the other point I want to make before I forget is that we're aware of social, cultural, and physical environments and how we use this evaluative framework. Again, keep in mind I'm using this for a lot of other things as they roll off. The evaluation uses the theories of behavior change, including the social cognitive theory and the health belief model to predict outcomes. And those are the kinds of outcomes we're looking at: healthy eating, visit adherence, etc. So there's a lot of challenges to all this stuff. Believe me, I've got scars on my back trying to get this through the DOD. Integrating it into electronic health record is a big deal. Remember, the patient-centered medical home needs an electronic medical record. Information overload. I got so much email now. Last thing I need is my patients texting me. So how am I going to take care of that, right? And a nurse, a physical therapist, we're no different. We're getting information overload. I got a bunch of different devices, smartphones, feature phones, different kinds of bandwidth, the security, privacy, and confidentiality. We set the bar high on a lot of this by using that kind of secure platform for that mCare project. And the FDA impact, as we get further into this, is FDA going to call the cell phone a medical device and make you adhere to the FDA regulations now because you're using it for medical applications? This is an important point. When I talk about the electronic health record, everything I've been telling you about so far has just been preclinical. But when I use your cell phone to say, okay, Jill, you're taking high blood pressure meds, and I'm going to have you tell me your blood pressure because you're checking it at home, and I'm going to go up or down on your medicines based on how well your blood pressure is controlled, now I've gone from preclinical to clinical. When I tell Jill to take 10 milligrams of drug X every day, and she was taking 20, I have to document that in the electronic medical record. And if I can't talk to the EMR to do that, I think it's going to really be difficult to see a lot of use of cell phones in healthcare. So that EMR, back to that whole point about the patient-centered medical home, is going to be critical. This is amazing to me. 13 December, the Army Times, front page, smartphones for every soldier. I'm back to Bjorn Borg at Wimbledon. I'm on the ground going like this, thank you, Lord. Now I got top cover. I'm looking for top